So welcome everybody. My name is Ed Shin. I am the CEO and co-founder of Quality Reviews. And for those of us who do not know what we do, we help health systems collect real-time feedback from patients as well as from providers, really for the purposes of improving experience through service recovery. And it is my pleasure to welcome today Rick Evans, who is Senior Vice President and Chief Experience Officer at York-Presbyterian in New York City. And we've been working with Rick for a number of years ago. So thank you, Rick, for joining us. Really appreciate your time today.
It's my pleasure.
So I would love to cover a lot. So I'm just going to dive right into it. Rick, you have a unique background, and I'd like to start with your career journey. And how did you get into patient experience in the first place?
Not what I planned. So my training back in college, which was in the last century, was theological. So I was training to be a Catholic priest. Back then you went to a 4-year college and then 4 years of graduate school. Most of those colleges are now closed. But just before ordination as a priest, I bailed. I'm the runaway groom of the Catholic Church. That's didn't quite leave the church at the altar, but pretty close. And mainly because I felt like my own views had diverged a little bit, and so I shouldn't proceed. And so needed a job. Got into the not-for-profit world pretty quickly. I ran a homeless shelter, a soup kitchen. Then I ran a national program that was focused on drug prevention. Many of you might remember Nancy Reagan and Just Say No. She created a national organization that I was director of for a few years. Pivoted into healthcare because I know how to raise money. So my first job was at a Catholic system in Delaware, where I was their foundation director. Learned almost immediately that Catholic hospitals have something called mission leaders, or vice presidents of mission. Mission leaders are people who very often are religious women, in many cases, who quite frankly founded a lot of healthcare in the US and are not given enough credit for that. But there aren't as many nuns and priests, and so they looked for theologically trained lay people. There I was, and I found my calling. So I became a VP of Mission Services at a system in New Jersey, just across the river here. And the CEO early on came to me and said, Rick, these Press Ganey scores look really bad. Can you do something about them? So I thought, well, again, my joke is I pray for good results. I'm good at that. But that was my introduction, learning about what are these metrics, why are they important, more importantly, how are they improved? That was 20 years ago, and now there's a body of knowledge around patient experience and patient experience metrics and how to move the needle on those. And so over time, I was recruited to New York-Presbyterian, and then when my son was born, pivoted to Mass General because we were New York grandparents. And became their first CXO, their Chief Experience Officer, and then was recruited back. How lucky am I to New York Presbyterian, where I'm their first Chief Experience Officer. So at high level, quickly, that's kind of how I got here. It's wonderful when your career exceeds your expectations.
That's great. No, that is a great journey, and I'd love to. There's probably a different story about how you left the priesthood, but that'll be another story.
Yeah, that's another webinar.
Yeah, absolutely. So let's talk about the pandemic. Spring 2020, New York Presbyterian in the news, one of the very first cases in the United States, certainly in the New York metro area. Walk us through what it was like in March and April. And, I just want to keep it open and what your overall perspectives are from that time. And then we can talk a little bit more about how things have transpired since then.
Yeah. So I've got some things to compare to. I was here 9/11 at those Jersey hospitals. I remember that day and how we responded. I happened to be in Boston when the bombing happened at the marathon, and now here during COVID. So the lesson of that is don't work where Rick is working. But all joking aside, this is totally other. Nothing like this. We learned about it. We started to hear about it in early January. We did start to prepare because we didn't know what was going to happen. Our CEO, Dr. Corwin, really did see ahead. I remember him talking about it right after the new year and saying, we got to keep an eye on this. But it exploded faster than any one of us could have anticipated. We were going up hundreds of cases a day. We have about 100 COVID patients in our beds today, this morning, to report, 104 actually. We topped out in March and April close to 3,000. We had to create ICU beds like nobody's business overnight. We went from 250, 300 ICU beds to almost 1,000 at the peak. We opened up a field hospital. Now we're lucky we had resources. Many others did not. It was, I won't lie to you, terrifying. I had chills up my spine almost every day. We had the trucks out in front of our hospitals full of dead bodies. I mean, I'll be frank. Our teams are not used to this level of mortality. We're used to being more successful in treating our patients. So we had everything hitting us at once. And the thing about this disaster that's different than others in many respects is you had to respond to the disaster while you were also vulnerable to it, catching COVID, family members, community members. So you had the stress on all ends, plus our community was shutting down around us. So I've never seen anything like it. I will say a couple things. It quickly became about supporting the front line so that they could do their work. By supporting the front line, I mean masks and PPE, which we were in the beginning a couple days ahead, and then we never ran out of masks. We never ran out of face shields. We were close, but we never, thank God, tipped. We never ran out of ventilators. We never turned a patient away, but we were a day ahead. It was a constant struggle to make sure that we were ready for the next 24, in some cases 12 hours. But it became about the front line. So getting them PPE, ethics and support around decision-making. We were shutting down visitation. How did you support family members? People could not or were afraid to go home after work. So there were lots of empty hotel rooms in New York. We bought them so people could go to a place they felt safe and weren't risking their family. Scrubs, dialysis materials later in the crisis, childcare.